Hello everyone, my name is Dr. Kasyapa, an endocrinologist from Narayana Hospitals. Today we come before you on the occasion of World Diabetes Day. It is a combined effort of International Diabetes Federation and World Health Organization, which has started in 1991. The concept of diabetes is as ancient as our Indian history, which was written in the oldest medical scripture available, the Charaka Samhita, 5000 years ago. Now, India has 1 in 10 people which is suffering from diabetes. There are multiple types of diabetes are there. Type 1 diabetes, type 2 diabetes and genetical diabetes as well as secondary diabetes and gestational diabetes, which is seen primarily in pregnant women. The theme of 2023 World Diabetes Day is Know Your Risk and Know Your Response regarding type 2 diabetes mellitus. Why we have taken this theme? Because 90% of each person who is having diabetes is suffering with type 2 diabetes rather than other types of diabetes. And only 50% of those population getting diagnosed every year. Why? Because the early features of type 2 diabetes are very subtle in nature, which will land you up in complication by the time of diagnosis itself. Coming to knowing the risk of the diabetes, there are some pointers which can lead you to this. Having an age of more than 45 years or having overweight, obesity or increased body mass index or waist circumference more than 100 centimeters in males or 90 centimeters in females, and having comorbidities like hypertension or dyslipidemia or having a relative with diabetes and leading a sedentary lifestyle, not doing any physical activity, not taking any vegetables daily in your intake, food intake. Finally, the symptoms of diabetes like overeating, overthirst and frequent micturition. If you have any of the two symptoms or 2 pointers from the above list, you immediately need to go to a qualified doctor to get tested for your blood sugars as well as glycated hemoglobin, which can diagnose you accurately. What if you don't have diabetes after getting tested but still has these high risk factors? This can only mean that you are going to land up in diabetes in the near future. What if you already have diabetes? You have to frequently and regularly check your blood sugars as well as control it with a proper treatment and do routine annual examinations about your eyes, heart, kidneys as well as foot, which are more prone to diabetic complications. The important points to take up as general population is believing in authentic information only. All the surveys says that quacks and non-medical professional and Google being the major culprits for misinformation. So whenever you get any doubts regarding diabetes, you better consult a qualified doctor to get your doubts cleared. And to know about the newer therapeutics and diagnostics regarding the complications of diabetes like comprehensive diabetic complication testing, continuous glucose monitoring and insulin pumps, which are available in our hospital. And when coming to the dietary modifications, you have to reduce your red meat intake and increase the proportions of green leafy vegetables, millets, fibers and other low glycemic load variants to alternate your diet. The concept of diabetes reversal also should be noted. The early and mild diabetics with vigorous lifestyle modifications and proper treatment and diet restrictions can see the diabetic reversal. But through this phase, you need to get continuously monitored for any recurrence. Finally, the most important and consistently beneficial aspect of all these, which is physical activity. You can avoid the diabetes or delay the diabetes perfectly with having a regular physical activity. Now you know the risks and you know how to respond to your risks. Thank you.